Hey everyone, how's everybody doing today? Let me make sure the camera's perfect. So, I just want to go over several medications that you do have to really know and that are important for your NCLEX exam. Now, in this video, I just want to also be very random and not sound like, you know, very robotic, right? I'm kind of ill prepared. Going through this review, but I will still be giving you guys the actual facts and the important information that you do have to know for your NCLEX exam, specifically the nursing considerations that you have to know and several indications and actions of these specific drugs. But at the same time, I just want to be somewhat, very conversation like in the way I go through with this review. Because it seems like the past reviews that I've done, it's so robotic and it's so boring. So I just want to kind of go off the cuff and just kind of be ill prepared, but at the same time, share the knowledge and the important facts that you do have to know for NCLEX exam. Right, so we're gonna actually go over five. Let me make sure it is five. So yes, we do have five drugs that we do have to know and be familiar with for your NCLEX exam, and that would be gentamicin, neomycin, streptomycin, cephalexin, which is Keflex, and cefaclor. Now, the first three is a category of drug that we call aminoglycosides, right? Now, with aminoglycosides, they're basically bactericidal antibiotics that act specifically in the outer membrane of the bacterial cell. Now, they work very well, particularly against the gram-negative bacteria. Okay. Now, one of the drugs that you do have to be mindful about is streptomycin, which is, I believe, it's used for clients with tuberculosis, right? So that would be one of the drugs that you do have to be mindful about. Now, like I said, aminoglycosides, these three drugs are bactericidal. Usually treatment for severe systemic infections of the central nervous system, and the respiratory and the GI and urinary tract, right? Well, like I mentioned before, streptomycin is the most common to be used for patients with tuberculosis. Now, the side effects for this aminoglycosides, a couple of the important side effects that you have to be mindful about is ototoxicity, nephrotoxicity, and some nausea and vomiting. Okay, so because of ototoxicity, we do have to check the 8th cranial nerve, right? 8th cranial nerve function, and that would be for hearing. So you do have to know your cranial nerves, right? And for nephro, due to the fact that it's nephrotoxic, obviously we have to check the renal function, specifically the BUN and the creatinine. And obviously we're going to encourage fluids for this patient, right? And these drugs are usually prescribed for about 7 to 10 days. Okay? Now, when we go over here on this side, now, cephalosporins, we're going to go over, these are what we call first generation and second generation drugs. Now, the first generation is cephalexin or Keflex, and cefaclor is a second generation cephalosporin drug. So, again, cephalosporins are also bactericidal, and they're actually very similar to penicillins due to the fact that they are broad spectrum, right? They're very broad in their treatment. And specifically, they interfere with the bacterial cell wall synthesis, which will eventually lead to cell death. Okay? So, what do we have to take note specifically for these two? Because these two are very common NCLEX medications, right? So, let's go over the indications in which we do use cephalosporins. Usually pharyngitis, tonsillitis, and otitis media. Those three are very big, okay? And also some upper and lower respiratory tract infections can also be treated with cephalosporins. Now, the side effects that we're looking at, we're going to be looking at some abdominal pain, nausea and vomiting, right? Um, there's also going to be increased risk of bleeding, right? And most importantly, we have a side effect of hypoprothrombemia, which is, as we all know, it's a deficiency in the prothrombin, right? And prothrombin is made and produced by the liver, and due to the deficiency in prothrombin, right? Like I mentioned before, the patient can have an increase in risk, have an increased risk of bleeding. Okay, due to the fact that it causes an impaired blood clotting reactions. Okay, so that's the important side effect that we do have to take note for cephalosporins. Okay, um, nursing interventions and nursing considerations that we have to be mindful about. It can cause ulcers, therefore we need to tell the patient, educate the patient that we're gonna to take it with food, right? Let me just skip the ad on this one. So this video that I have in the background is just basically a walking video of New York City. I love New York City, and why not? Just have it in the background. So another one would be we need to have vitamin K available, right? And that goes back to this for the hypoprothrombemia, right? Which is an impaired blood clotting reaction, right? And we need vitamin K to help with the clotting of the blood, right? So therefore, we need to have vitamin K available. Also, obviously, we're going to have to tell the patient to avoid alcohol, right, while taking the medication. And lastly, we're going to monitor renal and hepatic function for the client, because this cephalosporins can also be nephrotoxic. Okay, so I'm bordering about 7 or 8 minutes now, guys. Um, I just wanted to try something new. I feel that some of my reviews are just very, very boring, straight to the point, and there's no personality. And so I just want to have a very, how you would say, very random reviews, but at the same time, still be able to give you guys the most important information that you do need to know for exam. So that would be it for now. I will go over. I think I will be going over a lot of medications in the next videos, but these videos will be very, very random and very unique. So I can't wait. So that's all. Thank you guys. God bless. Enjoy your review. Stay safe out there. Bye bye.